Digestive system question 3. 16. An ambulatory care nurse is providing instruction to the client who is scheduled for a colonoscopy to remove polyp. Which of the following instruction would the nurse provide to the client regarding this procedure? 1. The client may consume food and fluids immediately following the procedure. 2. If the client notices blood-tinged stools after the procedure, the client should notify the physician. 3. Clear liquids only are allowed on the day of the scheduled procedure. 4. A laxative will be required in preparation for the procedure. The correct answer is 4. A laxative will be required for preparation for the procedure. 17. An ultrasound of the gallbladder is scheduled for the client with a suspected diagnosis of cholecystitis. The nurse explains to the client that is this test. 1. Requires that the client lies till the short intervals. 2. Requires that the client be NPO. 3. Is proceed by the oral administration of the tablet. 4. Is uncomfortable. The correct answer is 1. Requires that the client lies still for short intervals. 18. A nurse teaches a preoperative client about nasogastric tube that will be inserted in preparation for procedure. The nurse determines that the client understands when the tube will be removed in the postoperative period. When the client states 1. When my gastrointestinal system is healed enough. 2. When I can tolerate food without vomiting. 3. When my bowel begins to function again and I begin to pass gas. 4. When the doctor says yes, so. The correct answer is 3. When my bowels begin to function again and I begin to pass gas. 19. A client with a history of gastric ulcer suddenly complains of sharp, severe pain in the mid-epigastric area, which then spreads over the entire abdomen. The client's abdomen is rigid and broad like palpation, and the client obtains most comfort from lying in the knee chest position. The nurse calls the physician immediately, suspecting that the client is experiencing which of the following complications of peptic ulcer disease. 1. Perforation. 2. Obstruction. 3. Hemorrhage. 4. Intractability. The correct answer is 1. Perforation. 20. A nurse is providing instruction to a client who will collect stool specimen for occult blood. The nurse instructs the client to avoid which of the following for 3 days before the collection of stool specimen. 1. Milk product. 2. Hard cheese. 3. Turnips. 4. Cottage cheese. The correct answer is 3. Turnips. 21. The nurse has given post-procedure instruction to a client who underwent colonoscopy. The nurse determines that the client needs further instruction if the client stated that 1. Intake should be light at first and the progress is regular intake. 2. Its normal feel gauzy or bloated after the procedure. 3. The abdominal muscles may be tender from the procedure. 4. It is all right to drive once the client has been home for an hour so. The correct answer is 4. It is all right to drive once the client has been home for an hour or so.